Hey y'all, this is Dr. Ruth Roberts. Hope you're doing well and having a great day so far. It is cold, I think everywhere probably, but we're all thinking winter's over, and then lo and behold, here in Charleston, it is 30 some odd degrees today, this morning when we got up, and it's warming up and the sun's out, so that's all good. We've got a couple of things to talk about today. I get a ton of questions from people about kidney disease, and it is the most prevalent disease in this area for pets. Unfortunately, you get told that your pet has chronic kidney disease, and for many people, they're looking at their dog. They've gone in for an annual visit. They got some lab work done to make sure, everything was okay. And then lo and behold, the veterinarian tells them that your pet has chronic kidney disease, and they're thinking to themselves, well, my dog looks perfectly fine. And in many cases, this is the dog, because kitties are not exactly excited about going to the vet's office, and so they don't go as often. So for those dogs that are diagnosed early, the numbers are elevated, but your veterinarian is telling you it's just terrible and your dog's going to die. So what I could suggest is this. Let's figure this out step by step. And in fact, we had a question from Carol about her 13-year-old, 8-month-old pet that's been diagnosed with chronic kidney disease, and so she needs an action plan. So Carol, what I don't know is that a dog or a cat that you have and that you're talking about? And how is your pet? That's the other big question. Is it sick? Did you find out that it has chronic kidney disease because it was vomiting and lethargic and had diarrhea and it just is in terrible shape? Or did you go and get lab work done, and then lo and behold, these numbers are elevated? There's a huge difference, and that's also going to make a big difference as to what your game plan is. So I'll put a link to this catkidneyfailuretreatment.com. It's another website that if you give me your name and email, then you'll get a link to sort of 5 basic steps to help prevent or help treat kidney disease in pets. So let's start kind of at the beginning. There's 4 stages of kidney failure as identified by the International Renal Interest Society, which is veterinary medicine's group that sort of decides how bad are the numbers. So they've got 4 different stages. Stage 1 is relatively mild elevation of BUN and creatinine, and more recently, SDMA, which is a test that is providing a much more accurate, or I guess early diagnosis of kidney failure. And those, typically stage 1 to most likely stage 3, these guys are totally asymptomatic. So both the cat and the dog, all the way up through stage 3, they're really pretty asymptomatic. Stage 4 is when the pets start to show us symptoms. And that's when it gets a lot tougher to take care of things. And I think that's where conventional medicine does do a good job in terms of, treating the symptoms that your pet's experiencing with intravenous fluids or subcutaneous fluids to help sort of limit or diurese down the kidney so that they can do a little bit better job in functioning. And, I do have a kidney health program, which I'd love for everybody to check out. But frankly, at stage 4 kidney disease, it's going to be tough to get changes to happen rapidly and to get your pet back like nothing ever happened. So that's where we really have to figure out first what's what. But it's, a combination of things can be extremely helpful as far as, combining both conventional medicine and alternative medicine. So let's kind of go back to the beginning. If your your pet is in stage 1 or 2 chronic kidney failure, then chances are good that by simply making some changes, such as switching from dry food to wet food, and then protecting the kidneys with things like probiotics, fish oil, things of that nature, that's going to make an enormous difference in how those kidney values look on a piece of paper, and more importantly, how quickly they do or don't progress. So that's kind of the name of the game. The kidneys, they're eventually something's going to get you, and for most people that manage to outlive heart disease and cancer and things of that nature, kidney failure is what ends up getting them at the end of the day. So, for those early stages, there are some very simple things you can do. I covered that in a little bit more detail in the the kidney health starter kit that you can get. And so that's the deal, is figure out where your pet is. If your pet is in just end-stage kidney failure where the numbers are just astronomically high and intravenous fluid therapy is not helping that much, it's difficult to get things changed around. So that's where, all of these other things I suggest are more of a long-range plan as far as improving kidney function. So, but that's where things like acupuncture and vitamin therapy and the intravenous fluids and those types of things can be helpful for that pet that is in end-stage disease. So that's the biggest thing, is make sure that you know where your pet is, how it's feeling, and what you need to do from there. Unfortunately, most of my colleagues, if they see those numbers start to change as far as coming up into stage 1 iris disease even, they'll tell you that your pet has chronic kidney disease, and that's true, but that is a very different outcome from the pet that's already quite ill. So, Carol, that's my first question back to you, is dog or cat? And the reason that distinction is important is that it is a lot more difficult to get cats to buy into supplements and things of that nature, or even just to switch food. So kind of rule of thumb for kitties is, if they're eating dry food, try to get them to eat canned food first, and then from canned food go to cooked food, such as the crock-pot diet. So I think last week I told you the story about my kitty Romy, who's now 15. It took us 6 months to get her from dry food to canned food, and then another 3 months to get her from canned food to cooked food. And she still screams like crazy if we bring a sample bag of dry food in the house. And really, it's just insane how addicting that stuff is. The second thing for cats is there are several supplements that get recommended, that I recommend for kidney disease, regardless of where they are in that process. And one is probiotics, one is fish oil, as I mentioned, and then quercetin is another very important one. If your cat is not eating, please, please, please don't put supplements and stuff in there, because in the food that you're trying to offer, because it's just not going to work. And cats can get something called hepatic lipidosis from not eating for days. 72 hours is about all it takes. And as they start metabolizing their fat, the liver gets choked off and is no longer able to process the waste products. So now you have a cat that has chronic kidney failure, who now has hepatic lipidosis on top of that, and it's just a disaster. So keep your cat eating, most important. Supplements are great, but if your cat's is going to starve themselves literally into sickness or death, it's just not worth it. So if you can pill your cat, great. That makes most people laugh, and I've got about a 50% success rate with my own cats. 2 are like, okay, whatever, give me a pill, give me a capsule of probiotics, whatever. And the other 2 are like, no thank you, and make it quite clear that they're not going to have any part of that. So with kitties, you have to go really, really slowly. Fluids are so crucial for cats, whether they're in early disease or later stages of the disease. Old kitties tend to not want to to eat and drink much water regardless. And so by adding subcutaneous fluids, which you can learn how to do at home, you can help them feel so much better on a daily basis. So for some of these guys, we'll do it on a once or twice a week basis, and some of these guys on a daily basis. Again, with cats, if they say no, they mean it. And so you have to figure out what's going to serve your pet the best, but not create a daily struggle. So that's kind of the thing with kitties, is figuring out how you can help them without making your life and their lives miserable. For dogs, it's a really different story, because they'll be quite ill before they stop eating. And then in that situation, and just some intravenous fluids and some phosphate binders, if they're truly an end-stage kidney disease, can shift the balance from not eating back to eating. So they give you, and as long as the dog is eating, the vast majority of them will accept any type of supplement that you put in there, provided it's not too bitter. So that's just, it's a big difference. A lot of this I lay out in the kidney health program by stage of disease about what you can expect in each of those stages. So that's got a very clear literally cookbook for what you need to do for your pets in this situation. So that's what I got for this week. I hope you enjoyed the information we had last week on vaccines. If you didn't see it, check that out, because I go through both the recommendations through the American Animal Hospital Association for dogs and the American Association of Feline Practitioners for cats. Vaccines have a role in protecting your pet's health, but by far and large, we, as a profession, have way over-vaccinated pets, and it's just not acceptable to do this any longer. Unfortunately, many of my colleagues do still vaccinate on a yearly basis for almost everything, and so as a pet owner, you really need to have information available that you can say, hey, this is what the American Animal Hospital Association says is a good protocol for my pet. So that information will help kind of keep you prepared for conversations with your veterinarian about vaccines, vaccine schedules, your pet's specific risk for different diseases, and help make that conversation a little bit easier for both of you. So the one other thing I wanted to mention today is we do have our multivitamins in, getting some great feedback on it. I have a special offer for you guys that are watching this video today and kind of clue in and watch the video later. We've got a buy one, get one free sale. So I'll put a link to the holistic total body support for dogs, and there's the large dog size, smaller dog size, and then a cat version. But check it out, try it at buy one, get one free. You can hardly lose. So I hope you all are well, that your pets are well. And remember, your pet's best health starts in the bowl. Take good care.